Hello, welcome to another video post from Dr. Blake's Healing Soul. This is Ask the Podiatrist segment 5. There'll be an address at the end where you can send your questions and I will try on a weekly basis to answer them. So this was a question that I got and I receive all the time on my blog, and it's called, How do I treat a sesamoid fracture? We're going to focus today on just the first 3 months. First 3 months, a lot of activity has to happen. It takes a lot of effort, but it can really help make sure that when we're looking 6 and 9 months down the line, that we have had a good improvement. So the first 3 months, we start immobilization. That's your immobilization, anti-inflammatory phase. We get you in a removable boot. Within the removable boot, sometimes you have to do accommodations. You have to add stuff to the boot to float the sesamoid. So you do whatever you can in those first 3 months, and really the first couple weeks, to get a comfortable boot that you can walk through that will enable you to maintain that 0 to 2 pain level. As you are working on the immobilization phase, you also have to add the anti-inflammatory. And usually for 4 to 7 days, all people do is ice. They try to control the swelling from the injury. They ice 5 to 10 minutes with an ice pack or an ice soak 3 times a day. Once you get past a week, to get rid of the swelling, you have to start contrast baths. And I have a video on my YouTube channel that goes over how to do contrast baths, and on my blog a post on how to do that. So you start doing contrast baths every evening. During the day, you still ice several times. So really 3 times a day you're working on that part. You also have to ask the question, why did I break the sesamoid in the first time? And that's the same question that we ask anybody who's broken a bone. It's like, is there any problem with my calcium? Is there any problem with vitamin D or estrogen levels? So sometimes a nice conversation with your internist and making sure you have the right vitamin D levels going, that you're getting that 1,500 milligrams of calcium on a dietary intake per day, and that your everything else is well balanced. So it's during that first 3 months you're starting to you're doing your immobilization, and that's when you have to think about the 3rd month or the 4th month through the 6th months, and that's the time when you're going to wean out of the boot. So what are you going to need? You're going to need shoes. There's Ultra, Hoka 1-1, New Balance shoes that have rockers in them. You have to start thinking about, okay, how am I going to transition? And you also have to think about what am I going to put in the shoes. So you're usually thinking about dancer's pads and orthotics. Sometimes the orthotics will have dancer's pads put into them. Sometimes they'll be separate. There'll be sandals that you'll be able to wear that, as long as you put a dancer's pad, that will be helpful for you. So the other part of the picture is bone stimulators. I believe in bone stimulators from the get-go. Exogen makes one that you apply 20 minutes a day. Sometimes it's an issue with insurance companies, so you want to start the process of getting a bone stimulator approved, or at least know what it would cost you self-pay. And that's a 6 to 9 month application, so you're stimulating the bone and improving its bone health right away. The other thing is MRI. I love baseline MRIs. I think x-rays are a hard way of following this, although it's done and doctors do it all the time. But I think a baseline MRI somewhere along the line in the first month or 2, so that if you need an MRI 6 months later, you will have a comparison. And it's that comparison that's crucial. So I look at it as a baseline MRI. It'll give us some information. Sometimes it actually documents that you don't have a stress fracture, that something else is going on. But most of the time it just documents, yeah, there's a stress fracture going on, or fracture, bone bruise, whatever that's causing the sesamoid to light up, that we're doing this process. I think the last part I would do is that you need, as soon as you get an injury of any sort, you need to start strengthening your foot. So sesamoids, there's a little peculiarity, a little padding that I use, and I'm going to show you here on the floor. I use a system where, so you can start doing weight-bearing activities right away. You make a little well, so you take 4 or 5 magazines, and you produce a well so that your sesamoid can sit in that. And then you can do both your flat-footed balancing exercises and your Achilles stretching exercises to help get your strength going. So I hope this has been helpful. Please feel free to comment on the below the video on any of your thoughts or suggestions for other videos on sesamoid injuries, and I'll be happy to focus on just very individual parts of this. Thank you very much, and I appreciate it. And look below at the address to send questions to my